Infection Prevention and Control Policy in the UK. Introduction. Under the Health and Social Care Act 2008, the Code of Practice for the Control and Prevention of Infections and Related Guidance, DH, 2015, requires all trusts to have clear arrangements for the effective prevention, detection and control of infections, including the procedures to be taken in the event of an outbreak of infection. Purpose of the policy. This policy will ensure that responsibility for infection prevention and control is embedded at all levels of the organization. Effective arrangements are in place for the provision of a full infection prevention and control service, including policy production, surveillance, education and training, and audit led by an Infection Prevention and Control Team, IPCT. Infection prevention and control advice is provided by a suitably qualified and resourced team, which includes an infection control doctor and infection prevention and control nurses, with administrative and information technology support. The Infection Prevention and Control Team is supported by adequately resourced and staffed microbiology laboratories capable of promptly processing and reporting results on specimens sent for investigation. A multi-professional Infection Prevention and Control Committee is in place to advise and support the IPCT. All healthcare personnel working within the scope of this policy are aware of the rationale and responsibility to maintain high standards of infection control at all times. Objectives: to reduce healthcare-associated infection by providing the highest possible standards of infection control management within the limitations of available resources. To provide locally adapted guidelines as statements of good practice based on systematic review of research and other evidence. Appendix demonstrates the infection prevention and control policies and clinical care protocols in place to achieve compliance with the Health and Social Care Act 2008. These documents are available on the infection control pages of the Intranet. To generate infection surveillance data and feedback results to relevant parties in order to reduce mortality and morbidity and improve the quality of care. To audit practice and standards in relation to infection prevention and control policies and protocols and disseminate findings to appropriate groups. To ensure an ongoing education program, tailored to meet the needs of individual groups of staff, is available for all personnel.